Do you want strawberries?
Yeah.
Aliana was born in 2015, 3 years before babies and teenagers were routinely vaccinated for meningococcal strains A, C, W and Y. But even if she had been vaccinated, it wouldn't have helped, because at 13 weeks old, Aliana contracted meningococcal B.
She had a very big fight for life. Basically, Aliana, all she knew was hospital from 13 weeks old.
A vaccination for the B strain of meningococcal isn't on the national vaccine schedule, although it was recommended by the Federal Vaccine Advisory Body ATAGI back in 2014. The South Australian Government went ahead and added it to their schedule in 2018, as did Queensland in 2023. But the rest of the country is yet to catch up, and cases are on the rise.
In 2023, we saw 10% more cases than the year prior.
There were 112 cases in Australia last year, which doesn't seem like a lot. But 1 in 10 people who contract the disease will die, and a quarter will end up with a permanent disability, like Aliana.
There's been the acquired brain injury, I guess the neurodiversity struggles that come from it, the muscle struggles, the emotional disturbances.
There can be other debilitating outcomes: loss of limbs, hearing, brain damage, epilepsy, scarring and psychological trauma. Parents can elect to get the B strain vaccine, but it's costly.
For some families, this can be $600 upwards. And in today's economic environment, most people just can't afford it.
Johanna says for the government, it's a small price to pay.
Knowing what a horrible disease it is and the catastrophic consequences that this disease can have to people.
If you consider it's $10 million on average per disability, you're 1 in 4 end up with a permanent disability, you're 1 in 10 with a death. You do the maths, just like Queensland did last year, they save a lot of money.
The Northern Territory Government is considering adding the vaccine. New South Wales wants the federal government to add it to the national program, while Victoria, Tasmania and Western Australia say due to low case numbers, they follow health advice regarding expansion of the vaccination program in their states. Pamela Medlin, ABC News.